Topic. And before that, I want to say Happy New Year to everybody and welcome to the CME webinar series. And we have an excellent topic today, which is Ancient Wisdom Meets Modern Medicine, Primer of Integrative Medicine and Whole Health. And the speaker is Dr. Aarti Prasad, and moderator is Dr. Charles Elder. And I would like to welcome Dr. Amit Govil, the chair of CME, to do the introductions. Dr. Govil.
Thank you, Dr. Petula, and Happy New Year, everyone. And we are off to a great start in the new year, and nothing better than our speaker for today, Dr. Aarti Prasad, who is the Chief Strategic Development Officer at Heinemann Healthcare in Minneapolis, Minnesota. She's also a professor of internal medicine at University of Minnesota, University of New Mexico, and adjunct professor at Maharishi International University, where she serves as a director of fellowship, MS in Integrative Medicine and Ayurveda. This is a first ever fellowship for practicing clinicians worldwide. She's board certified in internal medicine and integrative medicine, and is also the founding member of the American Board of Integrative Medicine. She's a certified professional diversity coach and a certified physician executive, and also the director of Project ECHO in Minnesota Hennepin Healthcare. She and her team, they've been working on upstream holistic and integrative pain care, reducing health disparities in Minnesota. And the most fulfilling aspect of her career is to provide person-centered care to all her patients, creating innovative programs in health and healing, mentoring, coaching people, supporting DEI and health equity initiatives, and improving workforce wellness. So every aspect of well-being that we can think of, she's involved in that. So it's our privilege there. And moderating the session would be Dr. Charles Elder, who's the chairman, Department of Integrative Medicine, Executive Director, Fellowship MS in Integrative Medicine and Ayurveda at Maharishi International University. He's also the Senior Investigator, Kaiser Permanente Center for Health Research, and Emeritus Physician, Northwest Permanent Medical Group. So thank you, Dr. Elder, for moderating the session. And Dr. Prasad, we look forward to hearing from you. Thank you.
Thank you. Thank you so much. Good evening, everyone. It is really a pleasure and an honor to be here. I was waiting to share all this information with you, so I'm really excited. I hope you're excited too. We are starting about 9 minutes late, so we will see how I get through my presentation. I'll be fast at times, but we can also go a little bit over time. So thank you. Okay. I always start any meeting or work with a centering exercise. So today's centering exercise is around gratitude. I would like us to take a moment, and if you want to close your eyes, or if you keep your eyes open, maybe think of a person or something that you are grateful for. We never get enough time in the day to think about how grateful we are every single day. So I'll express my gratitude today. I'm really grateful to be here giving this talk for AAPI and getting to know a lot of people in my journey who are passionate about integrative medicine and Ayurveda. So thank you, everyone, for being here. The objectives of my talk today are several-fold. We are going to learn about the various definitions and concepts in the emerging field of integrative medicine and whole health, and understand the national movement and forces of whole health. And you are going to experience, I said, at least one modality of integrative health. You will be experiencing many as we go through my presentation. And they will be associated with a picture from the Venturi, Minnesota. So we will be, I will indulge you in that moment when we are at those pictures to experience an integrative medicine modality. Another objective is to recognize the value of traditional systems of medicine and lifestyle medicine for self-care and for the care of our communities. I hope you feel empowered to join the whole health movement to honor ancient wisdom and traditional systems of care. So this is my disclaimer, which is the role of the physician is to cure sometimes, heal often, and support always. And on the right-hand side, you see the picture of an ancient physician who was a Swiss physician, Paracelsus, who was an alchemist. He was a philosopher of the German Renaissance, and he was a pioneer in several aspects of medical revolution at that time, the 19th century. And he emphasized the value of observation in combination with received wisdom. And he said, medicine is not only a science, it is also an art. It does not consist of compounding pills and plasters. It deals with the very processes of life which must be understood before they may be guided. So here's our first practice. And Dr. Elder, can you put that in the chat function, what I sent you? So this is the first picture. It is from Minnesota, the winters in Minnesota. And a lot of time we see beautiful pictures and we say, this is beautiful. Oh, I want to be there. Oh, I don't want to be there. But I want you to take a moment and practice mindfulness here. So Dr. Elder has put something in the chat for you. And I would like you to take a moment to take a look at this picture in a different way and think about the questions which are in the chat about this picture. How do you think this picture is composed? What is in the background? What is in the foreground? And what are the most important visual elements in this picture? Is this picture telling us a story? What is that? And can this image be looked in a different way? So just take maybe like 3 seconds to think about these things. And feel free to put something in the chat if you want to. What we just did, or what I'm trying to convey to you, is sometimes we have to just be, being versus doing something. So we are just going to be in this moment to look at this picture and think about the various aspects. And that's kind of the mindfulness practice in integrative medicine. Okay, well, today I want you to have an open mind as you're going through this talk. Albert Einstein has said the measure of intelligence is the ability to change. And Frank Zappa said a mind is like a parachute. It doesn't work if it's not open. So I hope that you have an open mind as we go through my presentation today. I want to start with the story, which is my story. And that is back in 1995, when I started to practice medicine after finishing my residency at University of New Mexico. I have learned a lot from my patients. I call them my teachers. This is what I learned over the years from them. I see a different doctor at each visit, only seem to prescribe drugs. I feel rushed, unlistened to, ignores me as a person, more interested in my disease. And as a journalist at that time, I was having thoughts like these. I'm privileged to be in America and being a physician here. We have the world's best and largest healthcare system. We have advanced medical degrees, doctors, and technology. Why are patients still not happy, sick, and dissatisfied? What is wrong with this picture of healthcare here? Why are the healthcare costs so high in this country? Who takes care of the poor and people with low income here? What are the reasons for poverty and health disparities here? Why are my RVUs and productivities being counted, scrutinized? What can be done differently? So I started to look at this organization and its data. Organization for Economic Cooperation and Development. I have followed this organization and its work for the last 2 decades. And they actually do worldwide surveys of countries, developed countries, to look at various aspects of health, items related to health. So this is one of the data slides from the Organization for Economic Cooperation and Development. And this is about the estimated dietary fat intake per gram per day per person. Can you please find our country here? This is where United States is. in the estimated dietary fat intake per day per person. So in the US, we consume more calories per day than many other countries. And the average American diet contains more added sugars, refined grains, saturated fats, and sodium than recommended by US dietary guidelines. This was published in New York Times on May 5th, 2009. This is about times spent eating per day versus national obesity rate. And this is where United States is, top on the list. This is another piece of information, which is about percent of population with BMI more than 30 by country. And you can see that US is top of the list with the BMI more than 30. And this is the data back from 2015. Things have not changed much. They have improved a little. We have gone down on the list by World Health Organizations in 2022 in terms of number of people being overweight, but we are still topping in terms of the developed countries. And more than, we were the highest country, highest percentage of obese adults in the world, with over 33% of both men and women in 2022, with BMI being 42.87 as the median. So US obesity rate is nearly double the OECD average. And as you see that they have looked at all the other countries. This is the time spent watching television versus obesity rate. And can we find United States? And again, we are right here in the top right-hand corner. The Worldwide Association Between Television Viewing and Obesity in Children and Adolescents cross-sectional study published September 25th in 2013. And these numbers still hold true for US, where more people are watching TV than engaging themselves in physical activity. So although the US spends more on healthcare than any other developed countries, our health outcomes are generally not any better. We are, as you can see in the first one, health status, life expectancy, we are only a little better than Latvia. In infant mortality, we are a little better than Colombia. In quality of primary care, we are below average. In unmanaged diabetes, we are only slightly better than Turkey. In quality of acute care, we are a little better than Canada, and both US and Canada are at the bottom of the list. Heart attack mortality, we are doing better, but Costa Rica is actually on the top, and Mexico is at the bottom. So this is where we are. And I'm showing you all this data because I have followed this for the last 2 decades and why I do the work that I do. And this is what I'm presenting today. This is the US per capita healthcare spending as compared to other developed countries. We spend the most dollars on healthcare costs per capita as compared to any developed countries. So which is $12,555 as compared to other developed countries. And still our healthcare outcomes are so much worse. This is the healthcare system affordability in each of the countries, and this is where US is. And then see how do we do in equity. Our healthcare is not equitable as compared to other developed countries. And adults in the US are more likely to have multiple chronic health conditions as compared to people living in other developed countries. So the green bar is of the US. These are the deaths from assaults, which are highest in the United States. And these are the avoidable deaths per 100,000 population in the US, which are higher than average, 336. What are these avoidable deaths? Where do they come from? They come from the lack of preventable and treatable diseases and not having an effective public healthcare system. So very basics of life, prevention such as nutrition, diet, and exercise. And this can all be avoided if we focus on prevention. I already presented that. Our life expectancy at birth is 3 years lower than the other developed countries. We are the only high-income country that does not guarantee health coverage. And that is very, very problematic. We also have among the lowest rate of physician visits for primary care. You can see US as compared to other countries where we are, that patients are not seeking that primary care health services. And then we look at healthcare system performance compared to spending, the data that I have presented to you already. This is where we are on the grid as a country, as compared to all the other developed countries. Higher health system performance, we are not there. We are in the lowest quadrant of the health system performance, and higher healthcare spending. So treatment versus prevention, coming to that, we also know that United States GDP for health is spent majority on taking care of the sick people. Medical services, 97%, and focus on prevention is less than 3%. And public healthcare spending as a proportion of total health has been decreasing since year 2000 and falling also since the Great Recession. Our healthcare departments work across the country are really battling the 21st century health threats with 20th century resources. And nothing more than COVID-19 can demonstrate this reality in the starkest of its terms. So we like to pay for diseases and disease treatment, but don't like to pay for disease prevention. We focus on treating the sick and not enough focus on prevention and wellness. And if you really thought, as I thought when I started to work in this country, that we have the world's best healthcare system, I want you to think again. And we didn't even talk about this, the enormous profits that the healthcare industry generates. The big name health insurers like making billions in profits. United Healthcare, CVS, Aetna, Humana. So there's money in healthcare, but it resides in health plans, not in healthcare. So this is another moment now for practicing something related to integrative medicine. You can at this time stretch. You can raise your arms, stretch. You can do a chair yoga. You can move your body, or you can just have a reflection right here or take a deep breath, just kind of bringing you back in the moment at this time, in this room, in the Zoom room right now. Okay, so as I was following all this data for all this time, these two decades, what else was happening? This is the other data I was following. Like, where are these patients going if they're not seeing their primary care physicians? So a survey results were published in 1997 and in 1993 in New England Journal of Medicine and also in JAMA, which was an eye-opener for American public and for physicians, practicing physicians, and for the government. 40% of Americans used some form of unconventional therapy. This was published, this was the only big article which has been published in New England Journal of Medicine in 1993. And there were 629 million visits were made to complementary and alternative medicine providers as compared to 385 million primary care visits. And 60% of these patients did not even inform their physicians. And most of the patients used both. They used the modern medicine, conventional medicine, along with complementary and alternative medicine. People started to look at, like, what is this CAM, complementary and alternative medicine? So there was an office initially that opened in NIH, Office of Alternative Medicine, which was later on given the name, it became its own institute called NIH Center for Complementary and Alternative Medicine, NCCAM. NCCAM came up with the definition of complementary medicine and said, it is a group of diverse medical and healthcare systems, practices, and products that are not presently considered to be part of conventional medicine. Okay. This is the data that they published in 2012, that out of all of these CAM services, what people were using the most were the natural healthcare products. They were using relaxation response, deep breathing practices. They were using yoga, tai chi, and qigong. They were using osteopathic and chiropractic manipulation. They were engaging in mind-body practices. They were using massage therapy. They were on special diets. They were using other forms of mind-body therapy. And they were spending in billions out of pocket for these services. So this is the breakdown. The total cost out of pocket was estimated to be $30.2 billion for all of these services. And majority of them were for the 14.1 billion was for practitioner visits, not conventional practitioners, practitioner visits to complementary and alternative medicine practitioners. So this was another eye-opener for the government, for the state services, for physicians, and for our patients. Like what is happening and why is this happening? Is our healthcare system so broken that we are not able to provide care to these patients? Okay, then in 2016, this is the latest data, where it's now showing that there are 59 million people over the age of 4 who are spending $30.2 billion out of pocket for these services. And 14.7 billion is spent in seeing complementary practitioners. And it happens in all age groups, children, adults, elderly. And as the income rises for households, this out-of-pocket spending also grows. These are some other national trends. So NIH estimates that 40% of Americans are using complementary medicine. What is most popular is traditional Chinese medicine. And one out of CDC is also looking at this data. NIH and CDC also conducts this National Health Interview Survey every year. And they have noticed that the use of acupuncture in the United States has more than doubled between 2002 and 2022. It also found that 17% of US adults use natural products, including herbs. As of January 2018, there were over 37,000 actively licensed acupuncturists in the US, which was a 257% increase from 1998. What about yoga and meditation? And this is the data again from National Health Interview Survey conducted by CDC. The popularity of yoga has grown dramatically in recent years from 9.5% of US practicing yoga to 14.3% in 2017. Meditation has increased from being 4.1% in 2012 to 14.2% in 2017. And there are lots of other psychological and physical approaches which are being used. Majority of them are in the mind-body area. It just tells us that how stressed our population is. I think you can't have a primary care visit without your patient telling you how stressed they are. So psychological interventions are very important, and their patients are already engaging in many different kinds of psychological or stress management approaches here. The question is, why are patients using complementary alternative medicine therapies over conventional medicine, or sometimes with conventional medicine? So there is a belief that CAM therapies may offer slow down disease progression. It can alleviate symptoms of chronic diseases. There's a desire to alleviate side effects of conventional medicine. And there is a belief that the CAM therapies may enhance immune system. And patients also believe that they can form a better relationship with practitioners who are using complementary and alternative medicine versus conventional physicians. They like to engage in holistic approaches and natural therapies than taking medications. So looking at all of this data, which was kind of coming together, the national organizations came forward. The Institute of Medicine, which is now called the National Academy of Medicine, they came up with their report in 2005, and they said, well, we have to work on education to improve care in America. And medical schools, such as schools of medicine, nursing, and pharmacy, and allied health practitioners should actually include in education information about CAM into the standard curriculum at the undergraduate, graduate, and postgraduate levels. So that we can enable licensed professionals to completely advise patients on complementary alternative medicine. AMA also came up with a resolution back in 2006 and said that we have to promote awareness of CAM among medical students and physicians of the wide use of complementary medicine, including its risk, benefits, and evidence of efficacy or lack thereof. And if you look at AMA Journal of Ethics now, there's a whole section on complementary and integrative medicine. And this article that is quoted at the bottom right here, 2011 publication, physicians cannot ignore the importance of CAM to patients, whether or not they agree with its use. And AMA Education Hub has a number of articles, review articles on complementary and alternate medicine and integrative medicine. So these are some of the implications for medical education that as practicing physicians and as teachers and researchers, we must be able to advise our patients on the right use of complementary medicine, advise them on prevention and lifestyle medicine, what is natural, what's safe, what are some of the herb-drug interactions. And it's very interesting. Nowadays, I'm seeing in the drug inserts that they talk about maybe an interaction with a natural product. But in the past, there was nothing like this. And we always say, talk to your doctor about this. Well, doctor has no knowledge and doctor has no resources to get this information. So this is, now we have lots of resources, but this is the time when really there was an awareness and awakening for medical education. So here we're going to take another break for a moment, and you're going to look at beautiful northern lights of Minnesota. These are all real pictures, and think about your calling in medicine. Why did you go to medical school in the first place? Why did you come to America to practice? Why do you go to work each day? What is your calling? And just think about it, just reflect. This is a time for reflection. Because I was reflecting when I started to practice 2 decades ago. I've been practicing for 30 years. And 20 plus years, almost getting to be 30 years now in America. And as a journalist, the questions that are coming to my mind, I was reflecting, looking at this data and said, what is my calling? What is my calling? What do I need to do when I'm seeing all of this? And patients are coming to me. And I'm sure this is true with you all too, that you get to see patients from diverse medical backgrounds because you can connect with them. My patients were coming to me because they felt that they could connect with me. I'm coming from different culture, and maybe I will support them and advise them on the use of complementary alternate medicine or support their cultural practices. So this became my inner calling. I said, I have to go back to my roots. I have to go back to my roots. I grew up in India. I went to a conventional medical school, British type medical school, got that education. But at home, I grew up with the concepts of integrative medicine. We all have done that. Ayurveda, yoga, nutrition, diet, lifestyle is all part of an Indian upbringing, household upbringing. This is what's used. This is how you eat. This is how you sleep. These are the food combinations. You're always looking for folk remedies. Your grandma is telling you. Your nani and dadi are telling you that. Your parents are telling you that. So I said, I have to go back to my roots. I think I've gotten away from my roots. So I said, I'm going to work on prevention, health promotion, healing. I have to bring healing back into medicine with my work. That's all I can do. That is my contribution. I would focus on creation of health because health doesn't reside in the clinic. Health does not reside within the 4 walls of the hospital. Health actually resides in the community. Health is outside. This is for sick care that we provide. So, what reminded me is of Sir William Osler saying that it is more important to know the person who has the disease than the disease who has the person. Made perfect sense to me. Connecting with people, really knowing them as people instead of giving them a room number, understanding who they are in the society, who have a mind, body, spirit, family, and a community. And then looking at the definition of World Health Organization's definition of health, which says that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. WHO didn't know at that time that they were talking about integrative medicine, but that's the definition they created. So I said, I'm going to educate myself. I learned from my patients. And I said, okay, I need to do a fellowship. So I did a fellowship at the Andrew Weil Center for Integrative Medicine. I stayed in my job, but I engaged in this fellowship. And that was the first year when Arizona offered an online fellowship. Previous to that, they had a residential fellowship. So I was in the first class of the online long distance fellowship, which was then called the Associate Fellowship, but now that is the fellowship. That is the only fellowship. So I did my fellowship and, worked with the mentors. Dr. Andrew Weil is a very good colleague and a friend. I've worked with him over the years on many different conferences, public forums, fellowship, and I still get to go to Arizona. I'm going to actually Tucson tomorrow for alumni reunion of this fellowship. And also engaged with some of the work with Dr. Chopra, who made many visits to Albuquerque. He used to come, and we did some events with him too. So then I said, okay, what else do I need to do? Well, I have learned, but now I have to teach about this because there are lots of myths about complementary and alternative medicine. So I want to share with you that when people say, like they used to tell me that, I was a great physician. Aarti is a great physician. She was a wonderful primary care doctor. Something has changed with her. She has gotten into alternative medicine. And I would say, what is that word, alternative? Because I'm trying to do my best to integrate the best of both worlds, evidence-based medicine, evidence-based complementary and alternative medicine. So when patients use complementary medicine in place of conventional medicine, that's called alternative medicine. But when you use them together, that's complementary and integrative medicine. And the research says, epidemiological studies say that patients actually use both. They use it along with conventional care. So this is the definition of integrative medicine and health as defined by the Academic Consortium for Integrative Medicine and Health. And I'm going to talk about that a little bit later in my talk. But integrative medicine and health reaffirms the importance of the relationship between practitioner and patient. It focuses on the whole person, is informed by evidence, and makes use of all appropriate therapeutic and lifestyle approaches, healthcare professionals and disciplines to achieve optimal health and healing. And a long time ago, I was attending a talk back in 2000 because I was trying to really absorb. I was a sponge absorbing every information about complementary, alternative, integrative medicine. And this physician, I heard him at a conference. He probably doesn't even know that I use his quote in my talk. He used to play guitar, and he used to sing his story about integrative medicine. And he said, integrative medicine is care that creates more coherence within a person and also within their care. So I really love that analogy for integrative medicine, so I use it in my talk. I talked about National Center for Complementary and Alternative Medicine. Back in 1900, that's what the name was. It has now changed. It is now called National Center for Complementary and Integrative Health. Their mission is to advance integrative health through vigorous scientific research investigations and really defining the safety of complementary and integrative health, and including more concepts into creating a whole health model. So back in early 2000, NIH classified complementary alternative medicine into 5 different areas. One was called the alternative medical systems. Second was mind-body interventions. Third was biological-based therapies, manipulative and body-based methods, and energy therapies. Alternative medical systems included Ayurveda, traditional Chinese medicine, and homeopathy. Mind-body interventions, everything that we talked about, meditation, various forms of mind-body exercises. Biological-based therapies were vitamins and herbs. And manipulative and body-based methods were chiropractic, massage therapy, anything where you are touching a person to bring a therapeutic effect, and energy therapy such as Reiki and therapeutic touch. They don't define complementary alternative medicine like this anymore. This is how they define it. They are now classified under nutritional, psychological, physical, and combinations of psychological and physical. And then there are some subsets, which I'm going to show you. So nutritional is like special diets. Psychological is mindfulness. Physical is massage and spinal manipulation. Combinations are yoga, tai chi, acupuncture, dance. And I want you to pay attention how yoga is being used. So we have a reductionist approach in conventional medicine. We like to take things out and put them in a pill form. And that's how the whole problem started with soy and breast cancer. So they have taken yoga out of context from Ayurveda, and yoga has become very popular. They have taken acupuncture out of traditional Chinese medicine, and acupuncture is very popular. So what happened to the whole systems of medicine? Yoga is part of the whole system of medicine, which is Ayurveda. Acupuncture is part of whole system of medicine, which is traditional Chinese medicine. So this is how NIH has now defined complementary and integrative medicine as natural products, which are under the nutritional domain, psychological, which includes mind-body medicine, meditation, physical, manual therapies. They also have surgery outside here under devices, which are non-surgical devices, and then dietary supplements, and then drugs are here too, such as botanical drugs. So they have now coming up with this new concept. It's not NIH, it's happening all over the country. People are talking about whole health. What is whole person's health? The whole person health takes into account, it refers to helping individual families, populations to improve and restore their health in multiple interconnected domains, such as biological, environmental, social, rather than just treating disease. And then it also addresses social drivers of health disparities to improve health equity in our diverse communities as part of whole person health. So now you see how we are combining the current healthcare, which are given within the four walls of a clinic or a hospital, and then taking it outside to the community to address the social drivers of health and the population at large. NIH is now funding a whole health initiative. Huge grants are coming in, millions of dollars, to fund the whole person research, which you can understand how complex that's going to be, because it's going to explore the fundamental science of interconnected systems. They will investigate multi-component interventions or therapeutic systems. They will examine the impact of these interventions on multi-system or multi-organ outcomes. So this is their first big initiative, and big funding is coming for whole person health. So coming back to that final definition of what integrative medicine and whole health is, I think I've talked about most of it. I have given you the definition of complementary, alternative, and integrative medicine, and how the focus is shifting from being just person-specific, just a patient-specific, to becoming person-specific, community-specific. And it's a team-based care, well-coordinated care, where you're working with a variety of diverse practitioners to bring holism, to bring wholeness to a person's care. So NIH is doing a lot of this work, and you will say, where do you find all this information? Is there evidence for it? I have heard this throughout my professional career. Is there evidence for it? Yes. If you look for it, you find the evidence. If you don't look for it, you will never find the evidence. So 2 decades ago, there were only 5,000 citations on PubMed. There are over 40,000 citations available on National Library of Medicine, through NIH, through ACP, through AMA, AMA Ethics, the other resources. Many different health systems which have large programs in integrative medicine have also created evidence-based resources for all of this, so that can be easily found. Okay. This is a very scary picture of winter in Minnesota. This is really how it is ice age, right? That's what we have right now in Minnesota. So this is another picture, and I want you to just take a look at this picture and say, okay, she's been talking a lot. She's been talking a lot about this, but I don't know how to actually really implement this. So I want to show you that there is light at the end of this tunnel. And I want to share with you my practice and how I implement it. Just take a moment, take a deep breath. Let's come back in the moment. How do I practice? How do I practice whole person care? Look at this picture of there's an elephant in the room. There's an elephant, people are looking, or this is an elephant, it's a monument, whatever it is. People are looking at different parts of the elephant. And everyone has a place for this work. Yes, you want to focus on eyes, you can focus on eyes. You want to focus on legs, you can focus on legs. But in integrative medicine, we look at the whole elephant. We also look at where does this elephant live? What does this elephant eat? Does this elephant have enough water to drink? Where is that water coming from? And does this elephant has a society or a community? So we look at economic, environmental, biopsychosocial, emotional, spiritual model. That's kind of my approach. So my approach to health and healing is like 3 ways. Upstream, before a disease has happened, that's primary prevention. And primary prevention is not about screening. That's an early detection. That's early detection of diseases. Primary prevention is diet, nutrition, exercise, the main 3 things, and stress management, 4 things that is causing our GDP. Only we are not spending enough of our GDP for prevention, but most of the diseases are preventable. Midstream is at the point of care when somebody already has the disease. So I practice in oncology. I practice integrative oncology. I see patients who have cancer, who are going through cancer treatment, and I provide intervention at that time. That's midstream. And downstream, when somebody is recovering, so cancer rehabilitation and survivorship would be an example, or recovering from addiction. At that time, you provide intervention and use complementary integrative medicine. So in the current biomedical model, we have drugs and surgery, psychological approaches, and then if there's any time left, we can think about complementary medicine. But in the integrative health model, we think about self-care and use the therapies that stimulate capacity for self-healing. And then drugs and surgery are always an option. It's integrative, it's not alternative. So when I am seeing a patient with hypertension, in conventional practice, I would talk about drugs, diuretics, adverse and side effects of medications, diet and exercise maybe. I also teach residents in primary care. And it is really impressive to see that how quickly our trainees jump onto medications for every single disease that they see. It's not their fault. I think it's out of sight, out of mind kind of a thing. And if you look at the guidelines of any chronic disease, the first thing that shows up is lifestyle intervention. I think they skip that. We all skip that, and we are coming to medications. So in my practice, I'm seeing a patient with hypertension. I talk about diet and nutrition. I talk about yoga, meditation, exercise and relaxation, stress reduction, biofeedback, address family and social circumstances. Do they have access to food? What are they eating? And then also medications. So what I'm trying to do is integrate to expand the scope of my practice. I open new treatment options for patients, and I treat the whole person. That is the practice in every single case when I work with patients to take this approach. So at the center of everything is the whole person. And this has also become the motto of the Consortium of Integrative Medicine for a consortium of academic consortium for integrative medicine. 25 years ago, this organization was formed. At University of New Mexico, we were one of the early members of the consortium. Now this consortium has grown so much because more and more medical schools, healthcare, hospitals across the world are joining the consortium. They're joining this movement. From 1999 to 2004, these are the number of medical schools and health systems which are part of this nationwide community. You name it, there are Ivy League schools, there are community teaching hospitals, health systems, Mayo Clinic, and health systems from Canada, from Mexico. They're all part of this consortium because they're doing work in either education, research, policy, or clinical work. And they're trying to advance the field. There's American College of Lifestyle Medicine, which has come up over the last decade. You can get board certified in lifestyle medicine. They focus on nutrition, physical activity, stress management, sleep, restorative sleep, social connection, and avoidance of risky substances. So that's the difference between yesterday and today. yesterday, people like me were solo climbers, okay? We were trying to, we were the trailblazers. And I know many of those, that's my community. These are the people who have worked for 2 decades to bring integrative medicine to their healthcare systems, to their communities. Now we have American College of Lifestyle Medicine, Academic Consortium of Integrative Medicine and Health. We have American Board of Integrative Medicine. That was a lot of work of early pioneers to create a field, a board certification, so that we can legitimize the field. So I'm a founding board member of American Board of Integrative Medicine. We have Society for Integrative Oncology. Oncologists are part of this, work. We are trying to move the, this has been a grassroots movement over the last 2 decades. We have Academy of Integrative Medicine and Health, AIHM. We have Integrative Medicine in Residency Program, Integrative Medicine Fellowships, Integrative Medicine Leadership Trainings, Integrative Health Coaching, and Integrative Medicine Board Certification. Just knowing that we are not alone anymore, and there are other forces which are joining, and then of course NIH is there too. But an unfortunate factor remains, and what's that? Which is, you say, where is Ayurveda here? So many practices of traditional healers, such as Ayurvedic medicine, traditional Chinese medicine, homeopathy, naturopathy, they don't fit neatly into the NIH groups. They initially, when they created that 5 system, which I showed you, they were under alternate medical systems. But under the new definition, we don't have that. And there are only about 250,000 people in the US who are using Ayurveda. There are very few practitioners of Ayurveda compared to traditional Chinese medicine and acupuncturist. And I talked about our reductionist approach to medicine. We have moved away from holistic approach, reductionist approach, and we need to be in the middle, kind of integrative approach. So American healthcare system has reclaimed yoga. America has reclaimed yoga as their thing. America has also reclaimed integrative medicine as their own thing. Although we all grew up with the concept of integrative medicine, we never called it integrative medicine. I worry that very soon, America will also reclaim Ayurveda as their own medicine too. So this is about us. This is about our heritage. This is about our culture, that we support and promote Ayurveda in the larger context of integrative medicine. So Charak, Guru Charak, the father of Indian medicine, Charak Samhita, if you have heard of Charak Samhita, Charak Samhita was written 5,000 years ago. Charak believed to live during the 4th century before Christ, before BCE, although the exact dates of his birth and death are unknown. He was considered one of the principal contributors to the Charak Samhita, the ancient Ayurvedic text that is one of the foundational texts of Ayurvedic medicine. And it can be integrated within the scope of any healthcare practice, and it's applicable to all walks of life. It is such a profound body of knowledge that allows us to connect with and take charge of our own health. It also opens doors for connection with self and with spiritual practice for those who are looking for that. So this is the picture of the Charak Samhita, which is written in probably Sanskrit and Pali, and showing you some Ayurvedic herbs here. So this is unfortunate that Ayurveda has not received the same status as traditional Chinese medicine in this country, because they have a united front. They grew very fast, having a very organized system. And their marketing is also very good in that regard. And people are seeing benefit. I personally use traditional Chinese medicine. I go to my acupuncture appointments. I also use Ayurvedic medicine as for my own well-being and for my family's well-being. So what I want to share with you, that The first in the world fellowship exists today here in the US in Ayurveda and integrative medicine. We have brought the best of both worlds together. We have 500 hours of curriculum from the general integrative medicine, conventional integrative medicine, it's an oxymoron, conventional integrative medicine. 500 hours of that curriculum, which is combined with 500 hours of masters in Ayurveda from MIU to create the first fellowship in masters and Ayurveda, fellowship masters in Ayurveda. This is for practicing clinicians. This is for our residents who are graduating. This is for people, this is for physicians who are of Indian origin, because we are the only ones who can take it to the next step and reclaim Ayurveda in the US. So this is through Maharishi International University, and I'm very grateful to Dr. Charles Elder and others at MIU to come up with that idea. Unfortunately, AAPI did not come up with that idea, but AAPI has a role in it. I want to show you the fellowship class demographics. What you see on the left-hand side, this is the class demographics of the fellowship that I did back in 2003 at Arizona. You can see the number of disciplines which are represented in this fellowship class: pediatrics, general practice, family medicine, OBGYN, emergency medicine, surgery, gastroenterology, neurology, urology, rheumatology, oncology, internal medicine, dermatology, anesthesiology, orthopedics, nephrology, psychiatry, women's health, pain management, palliative care. It is vast. And so many people, I was very impressed when I joined this class. I had surgeons in the class. I had emergency medicine doctors, and I always wondered, how are they going to integrate integrative medicine? But people are doing it, loving it. And this is why this field is growing so rapidly. There are more and more fellowships coming. This is our class of MIU. The two, we are in our second class, second cohort. And our representation, we just this past year, we opened it also to complementary and integrative health practitioners, especially to chiropractors and naturopaths. It was already open. So we have one doctor of chiropractic, but internal medicine, some physician assistant, surgery, pain and musculoskeletal, psychiatry, ENT, family medicine, urgent care, neurology, and pediatrics. But we would love to see this pie chart growing by leaps and bounds and getting more specialties coming into it, because now we have the American Board of Integrative Medicine certification. Ayurveda did not have a practice license. It still does not have a practice license by itself, except for a few states. But if you're board certified in integrative medicine, you can practice Ayurveda and bill for it. So the time is now. The time is now. And the whole systems of care, like Ayurveda, is the middle, because there is consumerism. People want it. There are national organizations which are supporting this work at the highest level possible. There is board certification. And we know our healthcare system does not work for chronic diseases. And we have to teach people about self-care and lifestyle medicine, because that's how we can save money in healthcare and keeping people healthy and do in best way possible population health. And we can decrease the burden of chronic diseases. And cultural diversity of America, there's no question. We are going to look very different by 2050. You can Google it and you can see how people are going to look in 2030 and 2050 in America. So people are coming from all different cultures, and they bring with them a lot of wisdom and knowledge in their cultural practices. And we need to kind of leverage that to see how we actually support our growing population. And I want to share this, that I'd really love this quote from Thomas Edison, that the doctor of the future will give no medication, but will interest its patients in the care of the human frame, diet, and in the cause and prevention of diseases. And that's what Ayurveda does. In totality, do you think that integration of complementary and integrative medicine is a threat to modern medicine? I think it's a treat. You have more options for patients. It may be the solution to cut healthcare costs, integrative and whole health. And the future of healthcare is just a play of words, that we have to be partners and stewards together. We have to, walk in locksteps, because if we don't support it, our patients are already using it. So might as well use that opportunity to provide them the evidence-based care to make a difference. So this is the AAPI's call to action. Think about if we had a slogan like this: transforming the health of our nation when ancient wisdom meets modern medicine. And this number, which is at the bottom, the 250,000 people using Ayurvedic medicine, could be 250 million people using Ayurvedic medicine. Wouldn't that be nice? So I want to talk about and invite Dr. Amit Shah into this meeting, in the Zoom meeting, because Dr. Chakravarti, Dr. Amit Shah, and myself and several others have been talking about this vision, how AAPI can support the education, the growth, the spread of Ayurveda. What role should AAPI play in this? And Dr. Amit Shah has really taken a lead role in this, and I want to acknowledge both. There are 3 Amits involved, so it's hard to just keep track of Dr. Amit Chakravarti, Dr. Amit Shah, and now Amit Goval, who's introduced me. So Dr. Amit Shah, can you please unmute yourself and talk about the AAPI Ayurveda Consortium? And I'd really love the slogan that you created: One World, One Health System. Dr. Amit Shah.
Hello, everyone. Thank you very much. Thank you very much for attending this first Ayurveda Consortium initiated and with the partnership of Maharshi International University as well as AAPI. That this is a unique
and
opportunity.
Dr. Chakravarti is also on. Dr. Chakravarti is also on. So, okay, Dr. Chakravarti, you can come on too, both of you. Go ahead, Amit.
So I want to start thanking Dr. Chakravarti. Dr. Chakravarti, why don't you start?
So thank you so much for having me. Actually, I'm on my way to India because I have done so many sins that I'm going to Mahakumbh to wash my sins away. Hopefully, Ayurveda has something to do with that also. So I'm going to Mahakumbh right now on my way to India. But let me tell you something, and thank you for letting me go before you because I don't know when they'll shut my. I'm actually seated in the plane already, but I love the fact that you guys. Dr. Amit Shah actually called me about a year ago and wanted to float this idea of AAPI and Ayurveda, and I actually took that and ran with it. And we are in my year of presidency. One of the themes is a tripod of themes of AAPI and Ayurveda is one, TB-free travel India is second, and diabetes is third. They are the 3 prongs of my presidency. And AAPI and Ayurveda, I was so excited when I talked to Aarti and I talked to Amit and Dr. Elder. All these people are actually pioneers of making this happen. And I think this will be a theme during my presidency next year. And I want all your support. And we have got a fantastic team to lead this, and we need to make sure that Ayurveda becomes mainstream in the medicine of here. You know something that so many medications right now is being sold as supplements. A recent one is Burberry. Burberry actually takes care of glucose, blood glucose. There's so many other things which basically have their roots in Ayurveda and are being sold as supplements. I'm not an expert on this, so obviously I cannot speak too much on that. You guys are the person who can take this to the next level. But every governing body meeting, we will have Ayurveda um, uh, seminar, and we'll integrate this to the Global Health Summit, which I may take the little time which I've been offered, and I can. And my friend Satish Krishna Kathura has told me that I can go ahead and do that. My global summit is going to be in Orissa, January 9th to 11th, and you will have the greatest time because we're going to integrate pre and post, either pre or post. We're going to integrate Ayurveda, maybe in Kerala, complete with the whole Ayurveda clinic and everything. So so please watch out for that. Keep your whole January free. 2026. We're going to have a nice time, and one of the main themes of that global summit will be AAPI and Ayurveda. So thank you so much for letting me speak, and thank you so much for doing what you do. And I'm so excited, to be a humble small part in whatever you guys are doing. It's a massive thing, bringing Indian medicine into USA mainstream. This is awesome, and I'm humbled to be just a part of it. Thank you, and take it over, Sankhya.
Thank you, Amit.
Thank you very much. Dr. Prasad has given an extensive history and subsequently she has introduced Ayurveda as a part of the integrative medicine. Dr. Chakravarti really has supported us to initiate this Ayurveda consortium, which is part of AAPI, as well as with the partnership of Maharishi Ayurvedic University and so many other Ayurvedic stakeholders, what I call, including Government of India, Ayush Ministry, Embassy, Indian Embassy in DC, and so many other Ayurvedic practitioners. We are going to start this unique integration of conventional medicine, modern medicine, whatever we want to call, along with our ancient healing system. And I think going forward, I would request Dr. Satish Kathula to have a place for a Ayurvedic practitioner or teacher or professor to be part of all the other CME. So we can then discuss an Ayurvedic component in each disease process. That is our aim. And ultimately, we want to create a small courses, workshops that help our practicing physician how they can implement Ayurveda in a day-to-day practice. I, being an internist, I have converted my practice into the wellness center, and I'm learning. As I learning Ayurveda, I'm also implementing Ayurveda in each daily practice, and the system of dosha to the herbal supplements and whatnot. So I want to thank again Dr. Aarti Prasad, Dr. Charles Elder to support this CME program. And I want to thank all of you. You will listen and hear and get messages from us about our next programs. And thank you, Dr. Prasad, for introducing Ayurveda Consortium.
Thank you, Dr. Shah. And I'll bring in Dr. Elder to look through the chat box for any questions that people have and just help wrap it up. Thank you.
Yes, thank you very much. And thank you, Dr. Prasad, for that very engaging and thorough and uplifting presentation. So there's a number of, the chat is open. There has been a question about reimbursement. Perhaps Dr. Prasad, you can comment. The question came from Dr. Sheth, that for practicing doctor, getting reimbursed is very important to keep the light on. Do you think this integrated medicine will be reimbursed?
So as a physician, you can do a lot of things and get reimbursed. So in my practice, when I bill for integrative medicine, I'm using the conventional medical codes, the ICD-9 codes, CPT codes, to bill for my services. So integrative medicine consultation that also includes, some of Ayurveda is reimbursable. If you want to do an Ayurvedic consultation and use some integrative medicine and conventional medicine, it would be billable. So I've the practice that I created in Albuquerque Center for Life, which was an integrative medicine practice. It was insurance-based with some self-pay services, which healthcare will never pay for. They will not pay for meditation. They will not pay for massages. So those are the things people have to pay for themselves. But everything related to physician, where physician, clinician, or nurse practitioners is involved, is billable. So we only work with insurance. But Ayurveda can also come together, as there are few states, and Dr. Elder and Dr. Shah might know, where you could actually practice Ayurveda without getting attached, just like straight Ayurveda, and not, along with conventional medicine. There are a few states which have the freedom of practice bill, I believe. Yeah.
To add, if I may add the practice component, what I do is twice a year at least, one can bill code 99215, which is the highest code, and in which when you are utilizing more than 50% of the time in a counseling, teaching, etc., you can bill that 99215, which usually pays probably more than $100+. But because you are giving so much time, and you can combine your integrative or even internal medicine along with the Ayurvedic consultation and code that way. So that is just something on a routine, our CPT code or ENM code, you can build that. Of course, the other component, which are Ayurvedic massage or Abhyangan, Shirodhara, or medication, naturally, those are not paid anywhere. Many of them are over the counter. But I think there is a way to develop what I call a hybrid model, which actually I'm starting in next 2 months, where there is a subscription model where they can, and a lot of integrative, holistic minded patient will actually become member. One can charge somewhere between $125 to $200 a month subscription fee. And as a part of that, a yoga and other subscription services like Abhyangan, Shirodhara, even some Ayurvedic medication or supplements at a low cost, etc., can be added. So I think what we will see eventually is the hybrid model, where naturally you can still build the insurance company, and then the services which are not paid by insurance can be covered by the subscription model. So that's what I'm working. I'm hoping to start in next 2-3 months. But I think there is a way to practice in an integrative Ayurvedic way. And I think that will be very, very useful and effective.
Thank you. And in interest of time, we'll take one or two more questions. Yeah.
There are some questions about the fellowship. Dr. Elder, do you want to just give a short rundown on the fellowship?
Sure, thank you. So the fellowship is 2 years online. It takes about 8-10 hours a week of your time. About half the material is general integrated medicine and half Ayurveda. The Ayurveda component of the curriculum, of course, we developed at MIU, and the general integrated medicine component of the curriculum, we have licensed some curriculum from the University of Arizona, and we emphasize self-care, practical approach, immediately applicable. In our fellowship, immediately applicable into your practice. In our fellowship, you'll learn Ayurvedic pulse diagnosis, which is a very sophisticated tool that allows us to evaluate and detect imbalances in the physiology before they manifest as disease. So it enables us to tailor preventive therapies. It allows for personally tailored preventive therapies. So it's really an outstanding program. It's 1 year, it's 2 years long, 1 week per year on site, on campus, and the rest of it you can do on your own online. And when you're done with the fellowship, you'll get a master's degree in integrated medicine and Ayurveda, and you'll be eligible to sit the certification exam offered by the American Board of Integrated Medicine.
And I'm putting Charles, you can do that to your email in the chat. People can reach out if they have more questions about, specifics. Yeah.
Thank you.
I put my email in there, and there's a QR code in the slides too. There were other questions?
Yeah, Dr. Prasad, this is Satish Kathula. I do have a comment to make. Can you all hear me okay?
Yes, very
So
much.
thank you so much for that awesome presentation, Dr. Arti Prasad. So excellent. And I thank Dr. Amit Chakravarti for suggesting this topic and the speaker and the moderator, Dr. Charles Schiller. I'm an oncologist as well as board certified in lifestyle medicine. So, after I passed my boards, I realized that there is some place for alternative medicine because there are so many things that we don't pay attention to because there is data, but there is no marketing in alternative medicine such as Ayurveda. In oncology, we see even if there is a 2 week survival benefit, the drug companies spend billions of dollars to really market, and then people start using it. But with integrative medicine, with lifestyle medicine, with Ayurveda, there are some really good treatments which are not marketed properly. So that's why it is not getting really popular. So I think there should be some marketing for the products and things, treatments that we have evidence for. Definitely, AAPI can play a role, and I'm glad Amit Chakravarti, the incoming president, will be, taking a lead of that. But even this year, we want to help in whatever way we can until July of 2025. So also in the convention, which we'll have in Cincinnati, Ohio in July, so we can have this discussion and topic about Ayurvedic medicine and the uses and things like that. So we would like to invite you as a speaker for that as well. And it would be great to have you there in Cincinnati, July 24th to 27th. So, are there any more questions, Dr. Amit Govil, or?
Dr. Katula, thank you. Thank you so much for this invitation. We would be very excited. What we are trying to do is I would say that this is the work of passion. The only pleasure it gives us is to really bring it back, as I said, going back to the roots and bringing to our own community. And I really, truly believe that if AAPI cannot support this and would not support it, who else would? Because this is our tradition, this is our culture. And I'm just afraid that one day this is going to get lost or get demonopolized in a very different way in America, like yoga has happened. So I think this is the time to really think about this as an organization to support. It will be very nice to have young physicians of AAPI to be coming to these talks and listening, because they are the ones who are going to carry on the work as we all retire, and the residents and students who should be, they should feel proud of this fact that where they're coming from, and there is a value of this type of medicine in everyday life. So thank you for the opportunity. I'm sorry, I just took the stage just to say these things.
Thank you. I completely agree with your comments and suggestions, Dr. Prasad. So definitely, if AAPI cannot do this, nobody can. That's a very, very true statement. So definitely this year we'll try to do the best we can. But Amit Chakravarti, the incoming president, who has really passion for it, and my full support is there either this year or next year. So thank you so much. And we do have a plaque presentation, virtual plaque presentation. Ms. Vijay, can you please put that on? So, American Association of Physicians of Indian Origin, AAPI, recognizes Arti Prasad, MD, FACP, ABOIM, CPE, CPDC,
Oh my God.
for her outstanding contributions in the field of integrative medicine and whole health, and welcomes her as a member of AAPI Distinguished Speakers Club. Satish Kathula, AAPI President, and Amit Govil, CME Chair. So thank you so much, Dr. Prasad. Thanks so much, Dr. Elder, and thanks all the audiences today for attending this very important topic. So thank you all.
Thank you.
Thank you.
Thank you so much.
Thank you.
A great night and have a great trip, Amit.
Thank
Okay.
you.
Please get all of our sins washed off too as you do that.
Yes.
Yes,
I think his flight
please.
took off already.
No, he's
Yes.
there. He's there.
Thank you,
Is in?
Amit.
Okay.
Thank
Thank
you all
you.
the
Thank you.
Amits and
Take care.
Dr.
Thank you. Excellent job.
Take care.
Thank you so much.
Bye-bye.